Just give me a few seconds as it's coming up. Let's see. Okay.
Hi, everyone. Welcome to our newest episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital's experts, have them share vital information to your health and wellness, and give you the opportunity to ask questions during their presentation. In support of Stroke Awareness Month, today's guest is Dr. Joseph Akamah, an interventional cardiologist and Nashville General's Cardiovascular Services Medical Director.
Dr. Akamah completed his residency at John Stoker Hospital of Cook County and his fellowship here in Nashville at Vanderbilt University Medical Center. He has more than 25 years of diverse experience in interventional cardiology and treating cardiovascular diseases. Today, he will share information on stroke awareness, signs to look for, and what to do. If you have questions for Dr. Akamah, please feel free to comment below. Welcome, Dr. Akamah.
Thank you, Kathy and Kaylin. I'm glad to be here, and I'm really happy to be with your listeners and viewers across the world and around Nashville General Hospital. Today and this month marks the American Heart Association's celebration and recognition of stroke being a big problem when it comes to cardiovascular diseases and neurological diseases. So what I'm going to do is to talk about stroke in general, based on what is given to us by the American Heart Association. But before that, I want to tell you a little bit about Nashville General Hospital cardiovascular care and neurological care that we offer. So I work together with two cardiologists, actually three cardiologists from Vanderbilt, and we have an excellent team caring for patients who have heart conditions, vascular problems, and neurological problems. Most of these conditions are well taken care of. If we can't take care of you at Nashville General Hospital, we generally refer you to a higher level like Vanderbilt Hospital, St. Thomas, and Centennial, who work with us closely. We also have two terrific neurologists who help us care for stroke victims. We have an ICU, an excellent emergency room, and we have a 24/7 availability CT scan and MRI. So the problem is to come early so we can help you take care of the stroke that you are experiencing or somebody, a family member is experiencing. Usually we can care for all kinds of heart conditions here till we know that the person needs a higher level of care. We do interventions, we do bypass surgery through our sister hospitals, Vanderbilt, Centennial, St. Thomas Hospital. But if the person has need for stenting, we can do them at General. If the person has need for stenting of the legs because of a clogged artery, we can do them at General Hospital. So we have a robust system here, and the physicians are committed to the natives and indigents of Davidson County and the Nashville metropolis. So without much ado, let me go through these slides. I know you have a lot of questions pertaining stroke and the causes and other things, but I'll just give a gist of what I know that is important for you to know, especially now we're campaigning for the stroke month, this month, the awareness month. So please, let's go to the next slide. So most of what I'm going to talk about, you can get from the American Heart Association webpage. So I'll give them the credit for everything they've done, excellent information. Please, next. So stroke is a sudden loss of blood supply to part of the brain. And the brain has two arteries. that come off from the front end and 2 arteries that come off from the back side of the neck, supplying it. And it's intricate, it's very complex nature. The left side and the right side are such a way that they are interconnected in terms of their blood supply. But occasionally, one of the vessels might get blocked by a clot that came from somewhere, usually from the heart, in patients who have something we call atrial fibrillation, or it could be an innate problem that the person had a cholesterol buildup within that artery that broke off and caused a blockage. It can also happen because the artery got burst because the pressure was too high or the person had a problem with the artery. So generally, we look at stroke as having 2 types. The one that is caused by a blocked artery, we'll call it ischemic stroke, or some people tend to call it dry stroke because there's no bleeding. The other one is the one that happens when the artery gets burst or ruptures, and that's the hemorrhagic stroke or the wet stroke. We don't like stroke in general, and especially the hemorrhagic one is terrible. But the dry one, we can take care of it. If you come early, if your relative is brought to the hospital early, there are therapies that can help reverse it. And indeed, if the person gets to the hospital within the 30 minutes to 1 hour, and sometimes up to 3-4 hours, they can still do something, but the earlier, the better. And cardiologists, neurosurgeons who do interventions, neurologists who do interventions, interventional radiologists, all work together in the stroke centers to open up the artery. What other strokes can you hear? The different classification. You can come across terms like anterior stroke, meaning the front portion of the brain, or the posterior stroke, the back portion, the bottom portion of the brain, or the middle, the brainstem, where the brain is coming out into the to form the spinal cord. So all of these are terminologies that you may come across, and they present differently. That's the key point. They present differently. You may also come across terms like mini stroke or TIA or massive stroke, or they will say hemiplegic stroke or hemiparesis. These are all terms to describe the severity of the problem. What we do know, it is a number 5 cause of death and leading cause of disability in the United States. That is terrible. The havoc stroke causes is unbelievable. So it is imperative that we know the causes, the symptoms of stroke. The common ones we know will be weakness, numbness, or paralysis on one side of the body, slurred speech or difficulty understanding others, blindness in one eye or both eyes. So sudden blindness should not be taken lightly. Dizziness, severe headache with no apparent cause. Even if you tell there's a cause and the headache is worse than before, please seek help. Let's look at the next slide. So TIA is a commonly asked question. What is TIA? What does it mean in stroke? What does it mean? It is an important component of stroke, knowledge that you should put in your pocket. It is a mini stroke, but it is not really a minimal stroke. It should not be minimized. It should be taken seriously. It is caused by usually a clot or a blockage that the body is able to overcome, opening up the blood supply again. So the symptoms do not last longer than 24 hours, usually, before disappearing. Sometimes it's a flicker of minutes to 1 hour, 2 hours, it goes away, but it can stay up to 24 hours. But what the problem with TIA that we don't like is that it's a high danger of maybe worse things to come. It is probably going to be followed by a worse stroke that can disable the person. So a TIA happens before about 12% of strokes, okay? So it is important to know that. In one study, about 12% of the people who suffer TIA die within 1 year. So it is not a benign problem. It is not a mini problem. The risk of having a full-blown stroke is highest in the 90 days following TIA. So it is important that the person gets help. Let's look at the next slide. So we could look at, give me the next slide, please. So while she's at it, if there are any questions, please post your answers, your questions, then we'll try to answer them. Then we can go to our answers, discussions back and forth. Kaylin, give me the next slide, please. Okay, so if I'm going to share, I'll share my slide. So let me, so I can control it here. Is that okay, Kaylin? Okay, so I will, she's giving me permission to share from my computer. So the thing about stroke that you need to know is there are two ways to approach it. What we want you to know is to know the symptoms that will alert you. What are the things that will alert you to the fact that a relative, yourself, or a loved one is having a stroke, or a co-worker is having a stroke? So to do that, the American Heart Association and a lot of researchers have come up with these beautiful acronyms, okay? FAST, Be Fast, Faster, New Fast. These are all things that I'm going to go through. I know some of you have questions about that, but it's basically to have you think about what are the things that should alert me to say that this person is having a stroke. On the other hand, we can also think about what are the things that will confirm likely that this person has a stroke. This is usually done by the paramedics and other health providers outside the hospital. So those, we use the Cincinnati Peripheral and Pre-Hospital Stroke Scale, which usually focuses on three things: facial droop, arm drift, speech disturbance, and then the Los Angeles Pre-Hospital Stroke Screening, the LAPS, which focuses on a good history that says there is no seizure or epilepsy, age 45 and older, a baseline patient is not wheelchair bound or bedridden, blood glucose is not very low and it's not too high, and then you have to examine the person to see that they have facial problems, grip problems, meaning the arm weakness, and then also the strength in the arm. So if you look at the two, they are comparative, but it's comparable, but the Los Angeles one gives you more details. Having said that, we've seen young folks less than 45 coming with stroke. So don't get the age dissuaded, okay? Don't let the age dissuade you from thinking that somebody could be having a stroke. So to look at this acronym in detail, the American Heart Association makes it very easy for us to understand that somebody experiencing facial problems, facial drooping, saliva falling down, can't control, the mouth is twisted, then you think about the person having a stroke. If the person has arm weakness, cannot suddenly drops a cup, and that side of the body is becoming weak, think about a stroke. If the person cannot speak suddenly, think about a stroke. And what do you do with this? You have to act. That is where the FAST comes in. F is the facial droop, A, the arm weakness, S, the speech problem, and then the timeliness. You have to react. You have to call 911 and bring the person to the hospital. So this fast mnemonic can miss a number of stroke patients with different presentations. That is why other researchers and other centers came up with other acronyms. So some of them look at these other presentations of stroke. So we talked about the ones that are common, but there are other things that you should think about: sudden confusion, okay, sudden trouble seeing, sudden trouble walking, severe headache. These are not captured completely in the FAST acronym, but the American Heart Association makes it available that we should think about these when somebody comes in with sudden confusion and also unable to see. So one group decided that they would take the problem with eyesight and the problem with walking and make it a be fast, okay, be fast. So, and then one group said, let me add other things and make it faster. Then another group said, let's make it new fast. So these are all interesting. So let's see what they are talking about. Whatever it is, all of them has a fast in there. But the problem with that, with the fast, is that the acronym interpretation is slightly different depending on what you're talking about. For the American Heart Association fast, which is the commonest worldwide, it was done in 1998 in UK. Then we adopted it and we've been using it. Is the commonest one. The face, the arm, the speech comes, and then the timeliness. Now, University of Kentucky did a research and found out that some patients may be missed. So they added the balance, that's the walking problem, and then the eye problems. Then another group said, let's add a faster, let's get there faster. Okay, why should we wait time? And this group is the Beaumont Health Institution. They came out with this faster acronym, which works really well for them, and they've been using it to help patients. Then a young lady presented at Chicago with the new FAST acronym. So the BFAST basically talks about B being balance problem, gait problem, stability problem, walking, and then the E is the eye symptoms. When you combine that with the FAST, which is the same as the old FAST that we know, then you become BFAST. Okay, it doesn't change much. The only thing that happens is that you're able to detect more patients who would have otherwise been missed. But if you know that there are other ways stroke can present, then you can use this acronym properly, or keep to your FAST, but think that anytime somebody has an eye problem or is not able to balance, think about stroke. How about the FASTer? The Beaumont Stroke Center in Royal Oaks talks about the FASTer acronym. And it's that they've arranged things a little bit different from the FAST that we know. So their F still stands for the face, A stands for the arm problem, weakness. Now, S in their scenario is stability, whereas in the FAST acronym, S stands for speech. And then you have the talking, which is now coming in as the T. Then you have eye problems and you react. So do something about it. Call 911. And then you have new FAST. So Deborah Stable presented this in 2017 in Chicago, where she talked about using other things, because stroke can present in a very weird way that you may be dribbled. So know that somebody coming with sudden nausea, vomiting, headache, unable to see, double vision, field is cut off, the walking is not steady, the person has dizziness, facial droop, which we know from our FAST, arm weakness, which we know from our FAST, speech disturbance, which we know from our FAST, and then T for terrible headache, dizziness. So what she says is that we should think about these as possible problems that we should look at. Now, I know Kathy, whilst we're talking about presenting this program, she talked about women and stroke, and I think I wanted to let people know that we recognize that women the women group becomes one of the highest risk for stroke in this country and worldwide. And to the extent where we have now recognized that being a woman and having certain rhythm disturbance makes you at a higher risk of getting stroke. So for instance, if we have this condition called atrial fibrillation, it's a rhythm disturbance where the heart is just chaotic, it's not organized well, it's not contracting well, and medical students call it irregular heart. When that happens and the person is a woman, the stroke risk is higher. So we recognize that. So it's also recognized that women have a high risk for high blood pressure, especially if they had problems during pregnancy. Okay, so we have to recognize that. Stroke in US women by numbers, 1 in 5 women will have a stroke, okay? About 55,000 more women than men have a stroke each year. Of course, women live longer than men. So the older you are, it's likely that the person is going to have clogged arteries, atrial fibrillation. Stroke is the #1 cause of death in women, and stroke kills over 80,000 women per year. Whilst talking about America, we can look at it worldwide. Worldwide, this is a big problem because of blood pressure. Worldwide, this is a huge problem that we have to think about. In Nashville, we are honored to have all kinds of people around the world. This is an international town, metropolis, that we serve everybody from across. I think every part of the world lives in Nashville. So we are exemplifying what is happening to the world. And we see a lot of people coming with stroke. So I think I should end here and we'll take some questions, unless you want me to continue the lecture. Kathleen, you want me to continue? I have about 100 more slides.
We do actually have a question that came in through Facebook, so we can pause here.
Yes, I think we end.
Yes,
I think we should end and just have a discussion. I think this slide.
Well, first, we definitely thank you, Dr. Akamah, for sharing all of this wonderful information. I definitely learned a whole lot more than what I originally came into the discussion with about stroke and stroke awareness. But we do have a question, and the commenter says, on March 9th, 2020, I had a large stroke with a small blood clot that affected my left section of my speech. Loss of audio for 2 days, no other physical abnormalities. On April 12th, 2021, I went to my eye exam, and now I have an oculated vein in my right eye with blood in my jelly part of it. My eye is very blurred. I have an appointment with my retinologist in June. What is your diagnosis, or what do you believe is going on with this individual?
Well, I'm sorry to hear about your problems. And you're so young and going through so many issues with circulation. And I think your problem is not just you alone. There are a lot of people across the United States and Nashville that we encounter with problems like this. So the first instance could have been a stroke, and maybe it is difficult to know. We haven't talked about the causes of stroke, but there are numerous causes of stroke that we have to think about. What you need is a comprehensive evaluation from both a neurologist, a very good stroke neurologist, and a vascular person, hematologist, to look at your blood to see that your blood, there's any problem, disorder in your blood. And obviously your ophthalmologist, the ophthalmologist, the retinal specialist is going to treat the eye problem, but it doesn't take care of the reason. So there are a number of causes of stroke that in a young person, we had to think about. Maybe you're having rhythm disturbance, usually in older people, but it can still happen in younger people. You have something we call cryptogenic stroke, where there is a connection inside your heart and the clots can cross to the left side and then get into your brain and cause a stroke. Or you could be having a vascular problem, cholesterol and vascular problems, or connective tissue disease. So these are, I'm just all over the map. Yes, because I haven't seen you, I have not examined you. I can't tell exactly what has caused your problem, but identify with your problem. I sympathize with you. And I think have patience, follow the instructions from your doctors, make sure you do all the tests they tell you to do, screening. Most of it will be screening, searching to find out what caused it, and then they can take care of you. So best wishes, and I wish you a speedy recovery.
So you touched on what things we can do to prevent a stroke. Is nutrition, eating certain types of food to stay away from. And then also, if you have cardiovascular disease, are you at a higher risk for having a stroke?
Thank you, Kathy. Yes, so I didn't delve too deep into causes of stroke, but I'll touch on it briefly because it's a huge topic to discuss, but we should discuss it. I think it's important. What should we eat and what shouldn't we eat? We've heard this over time, but it all borders on the cardiovascular risk factors. Okay, the cardiovascular risk factors. So I expand on it. It so happens that stroke, the risk factors for stroke are similar to the risk factors for heart attack. So I usually try to tell people that a stroke is a brain attack, whereas heart attack is limited to the heart. So what can we eat to prevent a heart attack? What can we eat to prevent a stroke? What can we eat to prevent kidney damage from blood pressure? So the number one cause of stroke is blood pressure. It predisposes to stroke a lot. Cholesterol buildup is another problem where we have something we call atherosclerosis, where the cholesterol clogs up the arteries to the brain. Inside the brain, the tiny arteries are clogged up. And then we have this rhythm disturbance we call atrial fibrillation and other rhythm disturbances. Atrial fibrillation is a heart condition where the top portion of the heart is quivering. It doesn't allow the blood to flow to the ventricles, the lower portion, to be pumped out quickly. So when blood stays in a location for a while, a clot will form. So that's another reason. But diabetics, people with high cholesterol, people who smoke, family history of strokes. So these are all possibilities that we should think about. So in that line, diet that has a lot of high fat cholesterol, diet that has too much salt in it will predispose you to high blood pressure. High blood pressure will predispose you to stroke. Now, the problem with high blood pressure is not that it causes just one type of stroke. It can cause both types of stroke, and it can be devastating. Okay, so high blood pressure is a common cause of the hemorrhagic stroke in young folks, especially African Americans. So it's a huge problem. So it's important we decrease the amount of salt we take, eat heart healthy diet, which in a way translates to all parts of the organs in the body. Everybody will benefit. Even though it says heart healthy, it's not really for the heart alone, it's for the brain. It's been said that if you eat right, think right, relax right, you prevent Alzheimer's, you prevent stroke, you prevent dementia. As I mentioned, you prevent heart attacks and stuff like that. So, and if you control your diabetes, eat well, don't eat too much calorie-rich food, oil, chicken, fried chicken, and stuff like that. These are things that we should avoid. Your other question was pertaining to, can you remind me again? Kathy?
Does having a stroke increase your risk of a heart attack, or
Okay,
vice versa?
so, and then the cardiovascular conditions, yes. So I already alluded to the fact that they are twins, and sometimes they go together. Okay, I've personally taken care of two patients who came with a double whammy. They came with stroke and had a heart attack, or had a heart attack and came with a stroke. So it's difficult to know, but whatever it is, it can happen together. The risk factors are the same. So anybody, and these days we talk about the inflammatory conditions. What it means is that we're looking at a person in a holistic way to reduce all of these risk factors and reduce the chance of inflammation. When a person has any of the inflammatory prone conditions, obesity, high blood pressure, chronic infections, chronic inflammatory conditions like connective tissue diseases, then the chances of stroke, blood clots, DVT, PE, heart attacks goes up. So that means that anytime somebody gets a stroke, the chance of getting a heart attack is high, and vice versa. You get a heart attack, you're likely to get a stroke. And not just because of the risk factors, but the heart can be damaged in such a way that you can form clots in your heart that can be thrown off into the brain and cause devastating problems. Or the heart attack can predispose somebody to the atrial fibrillation and a rhythm disturbance that can predispose to stroke. So yes, they are comparable. Stroke also causes a lot of problems. After stroke, people can die from cardiovascular problems such as DVT-PE. Because the person is not moving, it can form a clot in the leg, and that can break off and cause a PE, the pulmonary embolism, where the clot travels to the lung. So they are very interchangeable in terms of the risk factors, and they can predispose each other. Yes.
Thank you, Dr. Akamah. So we do have another question that came in through Facebook, and the statement and the question from one of our commenters is, I had a stroke in 2011 from a blood clot that went to my brain. Do you recommend that I get scans to my brain and arteries after all these years as a follow-up?
So I'm sorry to know that you had it. And did you recover? You haven't told us, but I'm hoping you've recovered, and we pray that you continue to do well. I believe your primary care physician will be in a position to help you with this. Basically, there are a number of screening programs that have been advocated by all societies, the American Heart Association, the Stroke Foundation, the neurologists, the cardiologists. We all come with plans to help patients like you. So in your situation, we call it secondary prevention. And secondary prevention is basically you had a stroke, we do not want you to have another one. So there are certain things that you need to do. Basic ones will be echocardiography, making sure that you're taking your medications, making sure that you're getting your laboratory, your cholesterol is down. But in terms of scanning your brain, sometimes it depends on what caused your stroke, because sometimes the stroke is not due to a clogged artery in the brain. It could be a clot that came from somewhere else. So discuss with your primary care. He'll be able to tell you what type of stroke you had and where did the clot come from. Sometimes we don't know where the clot came from. It happens once a while, but most often they should be able, with your neurologist, should be, or the cardiologist should be able to come out to the pinpoint and say, your stroke was because of ABC. In that case, they will chase that sort of thing. But there are age-appropriate screening tests that we have to do, like doing the carotid Doppler to make sure there's no blockage in the carotid. The physician usually will listen to your neck for carotid bruit, like the noise, that swishing noise that happens in the artery. So I would say first stop with your primary care physician, look him in the eye and say, am I going to get another stroke? And then he should be able to help you navigate through these issues. Make sure you're eating right. Make sure you take your medication. Make sure your cholesterol is down. Know your numbers. Know your cholesterol, your bad cholesterol, your sugar level. Make sure your blood pressure is okay. And then hopefully we'll pray that you don't get another stroke. Best wishes.
Thank you, Dr. Akamah. And that is all the time that we have. And those are all of our questions from Facebook. We want to definitely thank you for talking with us today on stroke awareness. And please know, if you have any additional questions or need to see a cardiologist, please call 615-341-4968 to schedule an appointment with Dr. Akamah. Or you may visit our website online at nashvillegeneral.org. Once again, that number is 615-341-4968.
Thank you. Bye-bye.
I keep forgetting to unmute. Thank you.
Bye-bye.
Have a great day, everyone.
The same to you, and God bless everybody.